Joel James.
Thank you, Acting Cloward, and thank you, Minister, for your statement today. I'm pleased to hear that so many care leavers have taken the opportunity to engage with the trial and receive potentially life-changing sums of money. And I really do hope that enables them to break many of the destructive cycles that care leavers unfortunately experience. Picking up on some of the aspects of the trial, 635 care leavers have joined the scheme, which is considerably more than the 500 originally budgeted for. And the trial will now go around £5 million over budget, and this is not including the additional funding that you promised for those charities and organisations that are supporting care leavers with guidance. Given that you have recently announced a £7 million cut to your budget, there's considerable pressure on delivering more for less. Therefore, what specific outcomes of the trial are you looking at to determine whether or not a basic income is the best value for money in terms of helping care leavers? You have stated previously, Minister, and I quote that, this pilot, we hope, will enable us to test some of the claims being made for universal basic income. Given that the trial is now fully up and running and we are almost halfway through, I am keen to know what specific claims regarding UBI are being tested. As we know, I have previously expressed my concern in this chamber and continue to do so, that care leavers are a particularly vulnerable group with specific needs that do not necessarily reflect the wider population, and they were chosen to deliberately stifle opposition to these proposals. Without a clear set of outcomes to be measured related to UBI, then this trial is nothing more than a measurement of targeted financial intervention to a specific group, which is exactly the same as what is offered by existing welfare support. Minister, if the trial was found to be a success and you decide that basic income was to be rolled out to all care leavers at the current level on a permanent basis, whereby no care leaver ever stopped receiving basic income, and 500 new care leavers were added to the scheme every year, within 10 years the scheme would cost £528 million, without adjusting for inflation to help just 5,000 people. I think, Llywydd, that it is fair to say that we all agree here that it would not be financially proper to spend such large amounts of public money, especially when budgets are being cut elsewhere, trialling a scheme purely for its academic findings and without planning for a long-term implementation. Surely you wouldn't start a trial involving a vulnerable section of society without the intention of implementing it. So with this in mind, what plans are you considering to fund a basic income for care leavers on a long-term basis? Moving forward, as the Minister may be aware, a report from the Prince's Trust in 2017 found that care leavers struggle with educational attainment, with 87% of care leavers having less than 5 GCSEs at grades A star to C. It also been shown that 63% of children who entered care have tragically experienced abuse or neglect, which has had lasting impact on their emotional and mental health. And it is widely reported that 25% of care leavers are parents when leaving care, and this rises to 50% after 2 years. Furthermore, 25% of the prison population in England and Wales are also care leavers. Having a basic income is not going to resolve these issues. Many of those leaving care are still just as likely to become parents, just as they will have the same educational attainment and still have emotional and mental health complications. It is obvious there needs to be more effective policies introduced to help them. Given that only 635 care leavers will likely ever receive this funding, and it's never going to be financially viable to roll out wholesale, what steps are you taking to increase and improve support for those in care so that they can improve their educational attainment and their emotional and mental well-being alongside their peer group? And what steps are you taking to end the cycle that sees children of care leavers ending up in care? Finally, Minister, extensive research has shown that almost 1/3 of care leavers are not working or studying, compared to just 2.4% of comparable young people. And among those care leavers who were working, over 2/3 were in precarious roles that were short-term, part-time or poorly paid. This research has also shown that more can be done to remove barriers and disincentives to work for care-experienced young people, and a suitable approach to help care leavers is to provide stronger pathways for young people to go into and back into post-16 education and training and to strengthen links with local employers to improve young people's knowledge of the range of opportunities available to them. Other suggestions have also included targeted pre-employment, pre-apprenticeship support to prepare young people with the most complex needs to take steps towards work-related opportunities, and for education providers and employers to have greater awareness of the trauma and mental health needs for care leavers. Given that current care leavers in the trial will still need additional support to help them obtain jobs, what steps are you taking alongside the basic income trial to help improve job and educational opportunities? Thank you.